Hello again. I'm Dr. John Sirota. This is Chiropractically Speaking with Dr. John Sirota. We are going to talk about a neck syndrome. The topic is neck pain. The neck syndrome is something that goes like this. A patient comes in and says their neck hurts and they have headaches and there's spasm and pain right here. Okay? It runs into their shoulders, or it runs into this shoulder, or it runs down their shoulder blade and goes in between their shoulder blades. Typically, this person or patient has an occupation that requires a lot of sitting. Actually, the way I'm sitting right now. They could be sitting over a desk, they could be sitting at a computer, and they're slumped over, and they get preoccupied in their work, and they've been in the same posture for hours, and then all of a sudden they realize they're in a lot of excruciating pain. Now here's the deal with this. The patient says, I went to my general practitioner. The general practitioner or my GP, my family physician, regular doctor, sends them to physical therapy because that's what they do. They very rarely send them to chiropractors who do physical therapy. It is what it is. Patient goes to physical therapy, gets some physical therapy, it feels better because physical therapy is a good thing. However, the pain comes back. Why does it come back? It comes back because the physical therapist is not enough. Let's talk about why not. The physical therapist is doing physical therapy. It's a wonderful thing by itself, but a perfect marriage would be to have the chiropractor follow the physical therapist. So the pain is in the neck, it runs into the shoulders, it runs down the arms, it can go into the hands, it can go into the fingers, you can get numbness and tingling in your arms, hands, or fingers. You could actually have numbness and tingling in your toes or legs from a problem in your neck, neurologically speaking. That's how they're connected. The general practitioner in this example sends the patient to MRI. The MRI comes back, say, positive for a C4, C5, C5, C6, or C6, C7 disc bulge or herniation, or worse, stenosis of the spine in a person, say, older than 50. So the doctor says, physical therapy 12 weeks, twice to 3 times a week. I also want you to see a neurologist. We're going to do an EMG and an SSEP, which are tests to find out exactly where your nerves are being pinched. That's a good thing. And then the patient complies beautifully and goes and does exactly as the general practitioner said. Now let's fast forward 4 months. Pain's still there. Problem is still there. Next step, let's go to a surgeon. Let's get a surgical consult. Now here's how this becomes a problem. The surgeon has valid reason to operate on you because you have damage to your bulging, your disc, and it's bulging or it's herniated, and there's permanent damage there, so the chance of a successful outcome is probably pretty good from surgery. However, there is no guarantee, right? But you don't need surgery in 90% of the cases. Simple neck pain, spasm, radiating pain into your arms, hands, and fingers are easy to get rid of in most cases. Some ultimately will end up in surgery after I see them, or if I've never seen them, because it's just so severe. It's the point of no return, and nothing can be done. It just has to be operated on. But the syndrome is this: it's the headaches, the neck pain, the stiffness in the neck, the spasm in the neck and shoulders, runs into the arms, hands, or fingers, and is typically worse when they try to sleep, especially if they're stomach sleepers. So here's how I help. The first thing we do is reduce the pain, inflammation, and swelling by doing physical therapy again, specifically ultrasound, right over the area of injury, not directly over the spine, but adjacent to the spine. We do laser therapy and traction to alleviate the pressure on the nerves. When the pain is down to a manageable level, we then adjust the spine. I will adjust your neck. What does that mean? Does that mean that I crack your neck? No. Remember, we crack walnuts and we adjust spines. We adjust spines. Think of that. Adjust. If it needs adjusting, I will adjust it. If it does not need adjusting, I will not adjust it. What is an adjustment? An adjustment is restoration of a faulty joint. In English now, think of it as a bicycle chain that is a little bit rusty. And every time the kid rides the bike, the chain falls off because it's not quite as flexible as it used to be, and it's not functioning the way it was designed. Well, your neck will develop a kink in it associated with that bulge or herniation that we've been talking about. When there's a bulge or herniation, it affects the biomechanical aspects of that vertebrae. That very often causes a coincidental hang-up, if you will, in the normal function of that vertebrae. It gets stuck. Chiropractors are specifically trained to get it to move again. It doesn't hurt. It feels fantastic. Here's the best part. There is a reflex that happens instantaneously. Before my hands come off of your neck, it's done. In other words, if you've had spasm in your neck and shoulders, or it's problems down the middle of your back, in between your shoulder blades, and it feels tight, and I adjusted your neck lightly, and all of a sudden you turn over or you get up and you feel instant and immediate results. This isn't a temporary condition. This is permanent change in the way that vertebrae has been stuck, and it is no longer stuck. So by helping the vertebrae move the way it was designed to, the way nature, God, if you will, instilled upon our spines to have 6 ranges of motion: flexion, extension, bending, both right and left. That's 2 and 2 is 4, 5, and 6. Make sure that each vertebrae is moving in all 6 ranges of motion. Then your body can then take over and heal the way the body knows how to all by itself. The cervical syndrome is that. It is when the patient has experienced all of that prior to coming to me and realizes that after 3 visits or less, sometimes 1 visit, very often 1 visit, that the results are 80 to 90%. There will be residual spasm and pain going on because it's been there for 6 years. What do you expect? That will go away. As long as the root cause of the problem is addressed, as long as the vertebrae is moving and is functional and is healthy, your body will continue to move in the direction of health, and you will get rid of your neck problem. I'm Dr. John Sirota. I'm sure that I've evoked many questions, many concerns, many thoughts about what we've just talked about. I'm sure you want some answers. Call me anytime. I'm happy to discuss your case on the phone. If it's a case that I can provide an answer for on the phone, I'll do it. If not, you'll come in for a free consultation, and we'll do it in person. Thanks for watching. This has been fun. I'm Dr. John Sirota, and this is Chiropractically Speaking. Have a great day.